So you've been awakened at 3 a.m. in the morning, you're feeling groggy, and you receive a call from your senior. A case has been referred to him at the internal medicine department, a case of a patient who's 56 years old who presented with recurrent vomiting and abdominal pain with a history of eating from outside, precisely Kentucky. Now, they tell you to take full history. So how should I approach this case and what should I be doing? Now, from my personal experience, I've noticed that many medical students and precisely first year juniors and interns struggle with this. They get the history, however, they don't have a very well scheme as to how to approach these cases. So in this video, I will be explaining how to deal with these cases and how to actually have a scheme as to how to approach such history taking, especially in the emergency room. So without further ado, let us start. So what should you start with? Number one, you have to take the demographics of the patient. Now that includes the patient's name, the patient's occupation, the patient's gender, whatever they identify as and the patient's age, and you should also ask about their marital status and if they have kids or not, and their social support group. Why? Because this is all important for later. After you've done this demographic, and make sure you take the 3 names of the patients. Why? Because this happens sometimes in the emergency. You have patients with the same names coming up. After that, you move on to the most important part, which is the chief complaint. And this chief complaint is precisely why the patient presents to the hospital. So if they tell you, I came in with recurrent vomiting, they will not use the word recurrent. However, they'll tell you that we had vomiting and abdominal pain. And maybe they might even mention diarrhea. So you precisely note down what the patient says in their own words. And make sure that you write it as it is. Then you move on to the present illness, and this is where you further elaborate on the present history, the chief complaint. Now, for the present history, you have 2 ways you can approach this. If the patient presents with pain, then you would proceed with the mnemonic we call SOCRATES. However, if it is not associated with pain and you want to quantify it, then you would ask OD para. So SOCRATES, I will be attaching here a figure. You can see this figure right here. We can go over one by one, and you can see here. Then for the other one, the odipara is for symptoms such as shortness of breath or let's say vomiting. These you cannot assess because the patients don't usually present with pain. So therefore you could ask this odipara. They're almost the same, however, there are certain aspects that cannot be used in the odipara while they can be used with SOCRATES. Once you've asked all of these questions, you will move on to the next part, which is the past history. You would ask multiple questions. One of the questions you'll be asking is past medical history, and in those you assess the comorbidities of the patients. For instance, you have hypertension, diabetes, dyslipidemia, metabolic syndrome. If the patient has previous history of MI, for instance, or any strokes and atrial fibrillation. Then after that, you will be asking about the previous hospitalizations. And some people actually add the past medical history, they add the medication history. If they do add those, then you want to keep them here. If not, you can keep them in another subsection after the past history. You could also ask about any previous visits to the hospital, previous surgeries, previous traumatic episodes, for instance, car crashes or RTAs, previous ICU admissions. And after the past medical history, you can move on to the medications or drug history. So in those, you would ask precisely what the patient is taking, how much is the dose they're taking, and how frequently do they take, and if they are compliant or non-compliant with their medication. After you've done with this part, you will move on to the family history. You'd ask about the parents of the patients and their medical history, if they've suffered any heart attacks, or if they have any other comorbidities that might be related to our current illness. For sure, they would not know that. However, you should, as a doctor, know that. and you would ask about the vaccination history if the patient is a pediatric. However, we've clearly mentioned that this is an internal medicine case, so we don't usually ask about those unless the patient presents with influenza or meningitis or even COVID. You would also be asking about the genetic diseases. For instance, if the patient suffers from sickle cell anemia or thalassemia. After you've done with the family history part, you move on to the social history and the allergies. So let's take the allergies first. You would ask the patient if they have any allergies to any antibiotics. You would name them and what type of reaction occurred to the patient. If they don't have that, then you can just skip this part. Even if they take fruits and they suffer allergies, that should be clearly mentioned, because in the hospitals we usually provide hospital food, and they might have certain things that might act as allergens to those patients. After you've done this part, you would move on to the social history. Does the patient smoke? How often do they smoke? What do they smoke? And for how many years have been they smoking? Then you move on to the alcoholism. What do they drink? How many cups a day? How often do they drink? And for how many years? Then you would ask about who they hang out with, depending on the group of people, because you want to assess this after discharge, if the patient can be taken back to that environment or to find better environments. Once that's been arranged, you ask about if they have pets, for instance, if they have asthma, birds. You would ask about social support. The first part you mentioned the demographic, now you'll bring it back again and you'll ask about these questions. And one question you might want to consider is vaping, because some people will tell you that they don't smoke, but in actuality they do vape. After you've done with the social history, you can ask about the travel history. And the most important part here is to ask within the past 6 months. Then you move on to either what we call ICE, as an idea, concerns, and expectations of the patient, or you can proceed to the review of system. So I usually keep ICE before review of systems, however you can do either. ICE, usually you proceed with ideas. What ideas does the patient have? What concerns brought them to the hospital? And what is the expectation from the doctor after coming to the hospital? These are all things you should assess with the patient, because they will help in developing and formulating a differential diagnosis and treating the patient's current condition. After that, you move on to the review of the systems. Review of the systems is very important because you will not miss anything if you do it properly. Start from up to down or from down to up. Start with the head, if they have a headache, dizziness, if they have symptoms of lightheadedness, if they do have blurry vision, if they have a sore throat, if they have dysphagia, if they have chest pain, if they have tachycardia, if they have palpitations, if they have sweating. These are all symptoms you want to ask about. If they do have abdominal pain or if they don't, if they do have GERD-like symptoms, if they have constipation, diarrhea, dysuria, lower limb weakness or upper limb weakness. These are all questions you want to include, because sometimes you'd be surprised as to how much they go missed. So this is generally a very basic idea of history taking. Then you keep all of this information together in one place and you present it to your senior. I hope this actually summarizes everything I've been explaining to you. History taking, I would say, is an art. Not everybody has the skill to ask those questions. Usually when we study in medical school, we are presented with a STEM. That STEM is derived from questions that the resident or the intern asked prior to the presentation. So it depends on you and your skill. And I always say, interns are the best at taking history because they sit most with the patients. As you move on up the ladder, you ask less and less questions and you become more specialized, so therefore you concentrate exactly at what you're looking for. So if you've liked the contents of this episode, then please look at my other video for medical students on how to read the chest x-ray, and that can also be used for medical residents. So please like and subscribe to my content because it helps me make more content. And as I always say, stay safe.